Uterine fibroids are non-cancerous growths that occur inside the uterus, and they can occur in 4 major positions in the uterus. They can occur on the outer surface of the uterus, in the inner muscle of the uterus, such as in this diagram, or they can intrude into the cavity of the uterus. They can even occur on the cervix. Some of the women who are at risk of developing uterine fibroids include women between the ages of 30 and 40, women of African origin more than Caucasian origin, and women who have not previously had a pregnancy or delivery, or nulliparous women. Some of the symptoms of uterine fibroids include heavy menstruation, painful menstruation, infertility, bleeding in between periods or intermenstrual bleeding, painful sexual intercourse, painful passage of stool and urine or urinary and rectal symptoms. And of course, with the heavy bleeding, there's resultant anemia. Uterine fibroids are investigated or diagnosed by performing an ultrasound. They can also be diagnosed via laparoscopy or hysterosalpingography, which is an X-ray of the uterus that shows us the cavity of the uterus and its shape, which can diagnose uterine fibroids, or by hysteroscopy. Some of the medical options for treating uterine fibroids include drugs such as GnRH agonists, drugs such as ulipristal acetate, and even the progesterone-releasing intrauterine contraceptive device. Surgical options for treating uterine fibroids include myomectomy, which is removal of the fibroids only from the uterus, or hysterectomy, which involves removal of the entire uterus for those who are no longer looking to conceive. There are also other options of treating uterine fibroids, for example, uterine artery embolization, which involves introducing a clot into the vessels that supply the uterus. There is also MRI-guided high-intensity focused ultrasound, or MRI ablation of fibroids. And there's also resection through hysteroscopy, where fine equipment that has a camera is introduced into the vagina and cervix into the uterus to resect the fibroids that have prolapsed into the cavity of the uterus.